Hello, everyone. We will be speaking with Dr. Rέicsel-Piltts Lόουμπ, a preparedness fellow at Harvard University's Chan School of Public Health and an associate research scientist in NYU School of Global Public Health's program on population impact, recovery, and resilience. Welcome, Rachael. So happy to have you.
Thank you. Thank you for having me.
Our conversation will revolve around the coronavirus, of course. You're currently directing a project on vaccine hesitancy at Harvard. We will definitely get into that too, but let me first ask you, everyone and nations around the world have placed their hopes on the vaccine being rolled out to the general public so we can get gradually back to normal maybe sometime next year. Are you optimistic about this?
I am optimistic. I think the vaccines have been created and the trials have ensued faster than any vaccine we've ever seen in history. I think that the early data is positive, the early efficacy data. I think what remains to be seen and what we're all hopeful for is how quickly the vaccines can kind of be rolled out to the population. But we know that it's going to take time. So just because the vaccines exist doesn't mean that they're going to be ready for everybody soon. There's going to be kind of a process by which people can, certain populations get the vaccine, different kind of allocations for different countries, likely starting with healthcare workers at first, then potentially high-risk populations or essential workers, and then moving down to more of the general population. So the time will, it will still take time to kind of create the number of doses needed to vaccinate people around the world and to get it to the population, because the actual distribution will take a significant amount of time. So I'm optimistic. This has already gone much faster than we could ever have imagined prior to the pandemic, but this next phase, the logistics involved, the number of doses we need, and kind of the on the ground resources that are necessary to actually get the vaccine to people will take a significant amount of time as well. So I'm cautiously optimistic, I guess, is the best answer for you.
Mm-hmm. As you know, we need vaccination, not vaccines. So how do we get people to become vaccinated? What should nations strategically do to minimize vaccine hesitancy among the general population, and specifically with the AstraZeneca requiring 2 doses? It won't just be a one and done situation. Will that be trickier?
Absolutely. It's an excellent point. Vaccines are the first step, but what we really need is vaccination among the population. And there's a variety of kind of factors along kind of a continuum as to why folks don't get vaccines, whether that be they don't have access to them, they don't have kind of the resources to pay for them, they physically can't get to a facility where the vaccine is, or their beliefs, they're sort of skeptical of the vaccine. And depending on the group or the population, those factors kind of ebb and flow as to how we can address them. We know that vaccine hesitancy is incredibly high right now. Depending on what study you take a look at, anywhere from 30 to 50% of a given population says they won't take the vaccine. And some of that has to do with how the vaccine has been politicized, how there's kind of mistrust in governmental entities or the WHO and how they've responded to the pandemic, or a growing mistrust in vaccination in general, which existed and was on the rise prior to the pandemic. Mm-hmm. It was one of the WHO's top priorities in 2019, this increasing rise in vaccine hesitancy, even among kind of more common vaccines such as the measles vaccine. And so we know that vaccine hesitancy as well as vaccine access are going to be incredibly important factors and strategies that we need to think about. When we actually go to try and address that, there are a few things to keep in mind. One is that vaccine hesitancy is not a uniform belief. People don't wake up in the morning and typically say, I don't like vaccines, or I'm opposed to vaccines. Often what it is that people have other beliefs. I have a mistrust in how my government's handled this, or I don't believe vaccines are good for me because I don't like adding anything unnatural into my body, or perhaps they're against my belief system, or it's just not the government's job to tell me how I should handle my health. Whatever the belief is, it's not uniform, right? And so when we think about how to talk to the population about these vaccines and why they're important, we have to recognize that we're addressing a variety of different beliefs. And so that means that one message is not going to fit all. So what that brings the challenge, or the challenge then becomes, how do we strategize? How do we communicate with the population? So it takes a little bit of work, and for governments or for public health agencies, for healthcare providers to actually figure out which of those beliefs is most prevalent in their population. So we're doing some work trying to identify, what are the most common beliefs and who's holding those beliefs? Where do those kind of smaller, or where do those communities lie? How do we reach them through social media, through television or radio, or trusted community leaders? So this is really an all hands on deck effort to figure out which communities hold which beliefs and how do we reach them most effectively using the sources and channels of information that are most familiar to them. At the end of the day, in order to ultimately control the coronavirus, this COVID-19 pandemic, with a vaccine, we need as many people as possible who have access to the vaccine to actually take it. And that's going to take a lot of legwork to change some of these belief systems. In addition to sort of the risk communication efforts that need to happen to address vaccine hesitancy, the vaccine itself needs to be made available to people in their local communities. So, we know that sometimes it's difficult to physically access healthcare. It's difficult to pay for healthcare. And so the vaccine needs to be made available at local pharmacies in partnership with community health centers, or wherever it is that is most familiar to a given population to access their healthcare. So they need to feel comfortable, and it needs to be being provided in a similar manner to the types of health services that they already are accessing.
Interesting. You have stated earlier on in the beginning of the pandemic that essentially the source where information about the coronavirus comes from impacts the way this information is perceived, and subsequently maybe even the actions were taken regarding this. Does this apply now to the vaccine, if the coverage of the vaccine varies from publication to publication?
Yes, so I think that that's something that we definitely have to consider. Source of information in the past has been one of the most influential factors in whether or not people sort of engage in what we call protective action. So whether or not they're willing to shift their behavior to protect their health when it comes to a pandemic or a public health emergency. And this applied prior to COVID-19 and is likely to apply in relation to the vaccine as well. So our most trusted sources of information tend to be those that are close to us, whether that's your personal physician or healthcare provider, whether that's your family and friends, your coworkers, people who are in your own social network. So one of the things that's pivotal is trying to kind of blanket these sources that are out there to make sure that, the trusted sources of information are kind of consistently on the same page about the importance of the vaccine and about, why folks need to be getting vaccinated. That also applies to kind of media sources. So different people have, or media channels, different people have their favorite news source that they go to, people on Instagram or Facebook that they follow and they kind of are influenced by. And so this campaign to get the vaccine out has to do with our in-person social networks as well as the media and the social media environment, because people are getting information from so many different places. And we know that all of those places can be incredibly influential, but most importantly, those that are closest to us.
Now, until an effective vaccine is found and enough people have gotten it, governments will still need to make policy decisions based on data. Is it correct to make these decisions based on the coronavirus data we sort of see every day And how could a European government effectively communicate the urgency of COVID-19 when a neighboring nation implements a totally different approach?
Yeah, that's an excellent point, and it's something that we're seeing globally. Each country has been making kind of their own decisions. Sometimes even regions or states within countries are making different decisions depending on how the country's government is structured. And so I think there are a couple of things to consider when we think about the indicators or metrics that are being used to make some of these decisions. First and foremost, there is no one metric that is the encompasses everything we want to know or should know in order to make a policy decision. Their metrics are most useful when they are kind of thought of as an indicator or a light that we need to possibly be making a different decision. So, the trend in the positivity rate or the number of cases is going up. That means perhaps that there needs to be a shift in policy. But we also need to take a look at if say something like the positivity rate is going up, meaning the number of positive tests per the number of tests that are being conducted. If that rate is going up, then that's an indicator perhaps that there is an increase in the number of infections. But that also could mean that that's happening or being biased by a particular subgroup who's doing more testing, whether that's university students or healthcare workers or whomever it is. So I illustrate this, or I mention this to basically suggest that there are a variety of indicators that need to be looked at together and in a holistic fashion, not one indicator. Because in general, what can happen is if we focus too much on one measure that we see frequently being reported in the news, that measure can be gamed or kind of manipulated depending on or biased depending on who is being tested or how people are trying to get around using that metric. So what we should be thinking about, just to conclude, is how to use metrics together. So things like both the positivity rate and the number of cases and who is being tested and where those positive tests are coming from, as we try and get a sense of how is this virus growing or how are the cases increasing and where are those cases? Because at the end of the day, we need to be making as targeted and thoughtful decisions and policies as possible. So we want to probably be looking at a week over week or a 2 week over 2 week time as we try and get a sense of the trends that are happening. And we also want to be taking into account severity of infection. So what's going on with the hospital and healthcare system, and how does the increase in cases map to the capacity to handle those cases? Because at the end of the day, many of the measures that have been put in place to kind of slow the spread of COVID-19 have been to prevent our healthcare system from being overwhelmed so that we can continue to treat and provide care to those who are experiencing severe infection. Without the ability to do that, we add an increasing burden to the healthcare system and to the population, because at times that will then mean, of course, that other conditions cannot be treated effectively.
Well, this was Dr. Rέiczel-Piltts Lόub, a preparedness fellow at Harvard. She said she shed a little bit more light on the puzzling state that we all kind of live in during this pandemic. Thank you very much for being with us today.
Thank you.
This is all from us, ladies and gentlemen. Thank you for watching the stream and have a good day.